Many times patients come to us with LFT report and being worried about the LFT report. They say that doctor, I have an LFT report which shows increased bilirubin report. Good evening everyone. I am Dr. Pankaj Singh, Senior Consultant, Gastropedia Clinic, Noida. Today I will be discussing about a condition in which the LFT report shows increased indirect bilirubin, and one of the most commonest condition which leads to this finding is Gilbert syndrome. Gilbert syndrome is a genetic, benign, harmless disease which is a very common finding disease to have, but we need not to worry about the presence of this disease per se. It is a sort of phenotype which can be there, but it does not cause any problem to anyone's liver at that point of time or even in future. So we need to understand what actually is Gilbert syndrome. So before moving into that, I would like to say what is bilirubin. Bilirubin is a yellow pigment which is produced in the liver, in the blood, after the destruction of old RBCs or even after the breakage of new RBCs. So this bilirubin is initially in indirect form. When they reach to the liver, it is converted into conjugated bilirubin or direct form of bilirubin by certain enzymes in the liver. So if there is any sort of deficiency of that enzyme which converts the indirect to direct bilirubin, there will be increased amount of indirect bilirubin in the blood. So Gilbert syndrome is one condition where there is partial deficiency of this enzyme which converts the indirect to direct bilirubin. So in patients with Gilbert syndrome, there will always be a higher level of indirect bilirubin. But because of this, there will not be any sort of disease in the liver, or it does not even lead to any sort of problem related to liver in future. But the problems the patient may have is that he or she may have increased bilirubin at a certain time, like if the person is at stress, if there is any sort of illness ongoing, any fever, any sort of dehydration or lack of sleep. With these triggers, the bilirubin level might increase, and most of the time it is indirect bilirubin fraction which increases, and the person at that point of time may have a yellowish tinge on the eyes. So we need not to worry about this. This is a very common thing, and symptoms are negligible. Most of the time there is no symptom, except few of the patients they complain of fatiguity, which may or may not be related to this problem. Now regarding diagnosis, we can do blood test apart from the LFT parameter. We also need to rule out other conditions like hemolytic jaundice, which can also have indirect increased bilirubin. We should do a battery of tests to rule out all conditions which can lead to hemolytic jaundice. And for confirming Gilbert syndrome, there is a genetic test which is known as Tata box analysis, which is done in only few centers, which when positive shows a confirmed case of Gilbert syndrome. And I would like to conclude by saying that Gilbert syndrome is a benign condition which is not a hepatitis, which is not liver failure, and which is not related to alcoholic liver disease. So it is a lifelong disease which can be there in many patients. It is a phenotype where bilirubin will be high, but we need not to worry about that. So we need to, regarding treatment, there is no specific treatment. One need to have a regular meal, avoid fasting for a long period of time, and adequate hydration is important. And after all, at last, patient needs to be reassured that about this condition. Thank you.